Shoulder abduction is in the frontal plane. The muscles used for shoulder abduction include the supraspinatus. Spinatus. And its origin.
No, you have to restart now.
Spinatus. Okay. Supraspinatus. Okay. The shoulder abduction is in the frontal plane, and the muscles included are the supraspinatus, and the origin is the supraspinatus fossa of the scapula. Its insertion is the greater tubercle of the humerus, and another muscle is the deltoid, and its origin is the acromial end of the clavicle, acromion process of the scapula, and the spine of the scapula, and its insertion is the deltoid tuberosity of the humerus. And another muscle is the trapezium. And trapezius. And its origin is the occipital bone, the spinous process of the vertebrae, and its insertion is the clavicle, acromion, and spine of the scapula. And an exercise you could do that includes shoulder abduction is holding dumbbells in your hand and raising your arms.
You have to cut that a bunch. Super.
Okay, so elbow flexion is in the sagittal plane. The muscles include the brachialis. It originates in the distal anterior shaft of the humerus, and it inserts in the ulnar tuberosity and coronoid process of the ulna. Another muscle is the biceps brachii long head. It originates in the tubercle above glenoid fossa of scapula, and it inserts in the radial tuberosity of radius. Another muscle is biceps brachii short head. It originates in the coracoid process of the scapula and inserts in the radial tuberosity of the radius. The last muscle is the brachioradialis muscle. It originates in the lateral epicondyle ridge of the humerus, and it inserts in the base of the styloid process of the radius. An exercise you could do to strengthen these muscles are bicep curls with dumbbells or any type of weights. Okay.
So, knee extension is on the sagittal plane. Some muscles include the vastus medialis, which originates on the linea aspera of the femur. The insertion is the patella and tibial tuberosity via the patellar tendon. Another muscle is the vastus lateralis, which originates on the greater trochanter and linear aspera of the femur, and the insertion is the same as the vastus medialis. And the vastus intermedius originates on the anterior lateral surface of the femur, and it has the same insertion. And the rectus femoris originates in the anterior iliac spine, and the insertion is the same. And the sartorius originates in the anterior superior iliac spine and inserts on the medial shaft of the tibia.
And an exercise you can do.
Plantar flexion is done on the sagittal plane, and some muscles include the peroneus longus, which originates at the head of the fibula, and the insertion is the first metatarsal and the medial cuneiform. Also, the peroneus brevis, which originates on the body of the fibula and inserts on the base of the fifth metatarsal. Oh my god!
Ow! Were you done? Yes! Okay, good. And some exercises you can do are calf raises. The hip abduction is in the frontal plane, and some muscles that are used during hip abduction are the gracilis, and it originates in the body and inferior ramus of the pubis, and its insertion is the medial shaft of the tibia. Another muscle used is the adductor magnus, and it originates in the body and inferior ramus of the pubis, the ischium, and the ischial tuberosity. Its insertion is the linea aspera of the femur. And another one is the abductor longus, and it originates in the pubic crest and the pubic symphysis. And the insertion is the linea aspera of the femur. And the last muscle is the adductors brevis, and it originates in the inferior ramus of the pubis, and its insertion is the linea aspera of the femur. And an exercise you can do
Is this the exercise?
Yeah.
What's it called?